be discussing the anatomy of the hands and wrist. And to help us out, we've got Mickey here today, and we're starting out with the osseous structures. So to make it a little bit easier for you to visualize these structures, we're going to use our skeleton here, the Earl of Bergamot, and we're going to superimpose his hand on top of Mickey's. And we're just going to lay this in anatomical position, and that will give you a better idea of where these bony structures lie. So starting out, let's get kind of a general idea of the hand. We're going to break it up into three different sections. The fingers being the phalanges, the palmar area is the metacarpal area, and the wrist are the carpal bones there. Now, we number the fingers from the thumb 1, 2, 3, 4, and 5. And we're starting out distally and working our way proximally. So starting out with the thumb, here we have the first distal phalanx, we have the second distal phalanx, third distal phalanx, fourth distal phalanx, and the fifth distal phalanx. Now, the thumb is the only one that actually does not have a middle phalanx. It has a proximal and a distal. So moving to the second finger, we have the second middle phalanx, the third middle phalanx, fourth middle phalanx, and fifth middle phalanx. And then moving back to the thumb, we have the first proximal phalanx, second proximal phalanx, third proximal phalanx, fourth proximal phalanx, and the fifth proximal phalanx. Looking at the metacarpals, we have the first metacarpal, second metacarpal, third metacarpal, fourth metacarpal, and the fifth metacarpal. Now let's take a look at the joints that are formed between the bones of the hand. Starting out with the thumb, we have the first distal interphalangeal joint, also known as a DIP or dip joint. We have the second dip joint, the third dip, fourth dip, and fifth dip. Now, we'll go to the second finger here because there's a slight difference. The thumb does not have a proximal interphalangeal joint. It only has a distal interphalangeal joint and also the first metacarpal phalangeal joint or MCP joint. So, moving to the second finger, we have the second pip or proximal interphalangeal joint. We have the third pip, the fourth pip, and the fifth pip. Now, going back to the thumb, we already discussed that this joint here is the first metacarpal phalangeal joint. Here we have the second metacarpal phalangeal joint, the third MCP joint, fourth MCP joint, and the fifth MCP joint. Now we're going to discuss the carpal bones, or the wrist bones. Now this can be quite a confusing area for people to learn anatomically, but we've got a great mnemonic that'll help you remember the sequence of the wrist bones, and it goes like this. Some lovers try positions that they can't handle. Now, let's explain the mnemonic. So when we look at the carpal bones, first off, the hand is in anatomical position. We're going to be naming these from lateral to medial, and there's two rows of bones. 4 in the proximal row and 4 in the distal row. Now, starting with the first bone, the first word of the mnemonic, we have some, S for scaphoid. Lovers, L for lunate. Tri, T for triquetrum. Positions, P for pisiform. Then we have that, T for trapezium. They, T for trapezoid. Can't, C for capitate, and handle, H for hamate. So we have some lovers try positions that they can't handle. Now let's take a look at the posterior aspect of the carpal bones. So we're just going to turn the hand over, and as we do that, it's quite interesting to note how the radius rotates over the ulna, and then we get pronation of the hand. And here's the posterior aspect of the carpal bones. Now, if we look at the carpals from the posterior aspect, to orient ourselves, this would be the thumb here. So we have the scaphoid articulating with the trapezium and the trapezoid. If we look at this as a column. Then moving to the middle column, we would have the lunate articulating with the capitate. And then if we move more laterally, we would have the hamate on the bottom articulating with the triquetrum. Now what's not visible in this position is the pisiform, which would be on the anterior aspect, articulating with the hamate.
So let's start out our discussion of muscles with the flexors of the wrist. The first muscle we're going to go over is the flexor carpi ulnaris. This muscle runs from the common flexor origin at the medial epicondyle of the humerus, and it descends along the medial ulna and the styloid process. So right along here, the styloid process is actually near the wrist here. And it inserts onto the pisiform and also the hamate bone at the wrist here. In terms of the actions of this muscle, it flexes and adducts the wrist, and it plays a very minor role in assisting flexion of the elbow. The next flexor I want to talk about is the palmaris longus, and this will be the one coming down here in purple. Now, the palmaris longus arises also from the common flexor origin at the medial epicondyle of the humerus, and inserts on the flexor retinaculum all the way down here into the wrist and the palmar aponeurosis. The actions of this is that it flexes the wrists and assists weakly in elbow flexion. The third muscle we'll mention is the flexor carpi radialis, and this is the one in orange running down here. Now, this muscle arises also from the common flexor origin at the medial epicondyle of the humerus, and then runs down the forearm. Its tendon runs through the carpal tunnel all the way down to the wrist here, and inserts on the base of metacarpals 2 and 3, so right across into here. Now, the actions of this muscle is that it flexes and abducts the wrist, acting on both the radiocarpal and midcarpal joints, and assists weakly in elbow flexion and pronation. So now that we've talked about the flexors, let's talk about the extensors of the wrist. There are two extensors of the wrist that we're going to discuss. These are the radialis muscles. So running above from the humerus all the way down to the wrist. Now, these two muscles pass lateral to the radius through a fibrous sheath at the level of the wrist and end on the posterior side of the hand. Now, the first muscle we'll discuss is the one in orange here. This is the extensor carpi radialis longus. Now, this muscle originates from the lateral epicondyle, common extensor origin, and supracondylar ridge of the humerus, back up in the arm here. Its tendon passes under the extensor retinaculum at the wrist and inserts onto the posterior base of metacarpal 2. The actions of this muscle is that it extends the wrist, abducts the hand, radial deviation, participates in elbow flexion. The second muscle, the one in purple here running down, this is the extensor carpi radialis brevis. It arises from the common extensor tendon, where its origin is, and it inserts farther down on the wrist here on the posterior base of metacarpal 3. Its actions are to extend the wrist, and it also participates in elbow flexion. The last extensor muscle of the wrist I want to talk about is the extensor carpi ulnaris. This will be the muscle in green here, running down. Now, this muscle originates from the common extensor origin and the posterior border of the ulna. It goes all the way down here, and it basically passes under the extensor retinaculum and inserts on the posterior base of metacarpal 5. The actions of the muscle is that it extends and adducts the wrists. It also weakly participates in elbow extension. In the next section, we're going to discuss the extrinsic flexors of the fingers. We'll be discussing two muscles. These two muscles, whose mass is arranged on top of each other on the anterior surface of the forearm, and whose tendons end at the end of the fingers of the phalanges. The first muscle we're going to discuss is the flexor digitorum profundus. It has a broad origin on the anterior and medial ulna, and on the medial half of the interosseous membrane between the radius and the ulna, which connects the radius and the ulna. It splits into 4 tendons as it gets down to the hand here, and it passes through the carpal tunnel and inserts on the distal phalanges of the fingers 2 through 5. At the level of the metacarpals, these tendons attach to the lumbrical muscles. This is very important. Now, the actions of this muscle is that it flexes the third phalanx towards the second and participates in flexion of the other 2 phalanxes. The next muscle we're going to discuss is the flexor digitorum superficialis. This muscle has 2 heads. One originates from the common flexor origin and the coracoid process of the ulna, the other from the anterior surface of the radius. Now, the muscle splits into 4 tendons as it goes farther down the arm here, which pass through the carpal tunnel, superficial to the tendons of the flexor digitorum profundus, and they split into Y shapes to accommodate passage of the flexor tendons and inserts bilaterally on the middle phalanges of the fingers 2 through 5. So if we see here, it splits and then it goes on each side of the finger here. It's really quite interesting. Now, the actions of this muscle are that it flexes the second phalanx towards the first, and due to the fibrous sheath, flexes the first phalanx on the metacarpals. It also assists in flexion of the wrists and plays a weak role in elbow flexion. In the next section, we'll go over the extrinsic extensors of the fingers. So the first muscle we're going to discuss is the extensor digitorum in orange here. Now, this muscle arises from the common extensor origin, passes down the back of the forearm, and it splits into 4 tendons. Each tendon in turn splits into 3 bands. So farther down here, which the central band, right in the center here, inserts on the posterior base of the proximal and middle phalanx, while the 2 lateral bands reunite at the base of the distal phalanx. The actions of this muscle are that, together with the lumbricals and the interosseous muscles, it assists in extension of the interphalangeal joints. The next muscle I'd like to talk about is the extensor indicis. This muscle arises from the posterior ulna and interosseous membrane, below the origin of the extensor pollicis longus. Its tendon runs down and it actually joins that of the extensor digitorum, leading to the index finger. Basically, the actions of this muscle is to reinforce the actions of the extensor digitorum on the level of the index finger. The next muscle I would like to discuss is the extensor digiti minimi. This muscle originates from the common extensor origin and its tendon that joins the extensor digitorum, leading right down all the way to the little finger. Now, the actions of this muscle is basically that it reinforces the action of the extensor digitorum on the level of the little finger.
Let's take a look at the extrinsic muscles of the thumb. Now, the flexor pollicis longus originates from the anterior radius, and its tendon passes through the carpal tunnel and inserts on the base of the distal phalanx of the thumb. This muscle acts to flex the interphalangeal joint, the metacarpal phalangeal joint, and the carpometacarpal joint. It also assists in the flexion of the wrist and in abduction, or radial deviation. The next muscle we'll discuss is the abductor pollicis longus. This muscle arises from the posterior surfaces of the ulna, radius, and interosseous ligament inferior to the supinator. Now, the tendon passes under the extensor retinaculum and inserts on the lateral base of the first metacarpal. The actions of this muscle are anterior medial movement of the thumb, but it also assists in flexion of the wrist and abduction or radial deviation. The next two muscles we'll discuss are the extensor pollicis brevis and extensor pollicis longus. For the purpose of the video here, we've colored the pollicis brevis in red and the pollicis longus in purple. So looking at the extensor pollicis brevis, it originates inferior to the abductor pollicis longus. The tendon inserts on the base of the proximal phalanx of the thumb. The actions of this muscle are extension of the metacarpal phalangeal and carpal metacarpal joints of the thumb, and it also assists in abduction of the thumb. Now, looking at the purple muscle here, the extensor pollicis longus, this muscle arises on the posterior ulna and interosseous membrane, inferior to the extensor pollicis brevis. It inserts on the base of the distal phalanx of the thumb, and its actions are the same as the extensor pollicis brevis, but it also extends the interphalangeal joint of the thumb, and it is the only muscle that can do this. We're going to discuss the intrinsic muscles of the thumb. The first muscle we'll discuss is the adductor pollicis. Now this muscle has two fibers. The adductor pollicis obliquus, that arises from the trapezoid and capitate bones, and the adductor pollicis transversus, that arises from the third and second metacarpals, as well as the corresponding metacarpal phalangeal joint. Now, the two fibers insert on the medial base of the proximal phalanx of the thumb and the medial sesamoid bone as well, located at the metacarpal phalangeal joint of the thumb. The action, it performs a couple of actions. The first being that it helps move the second metacarpal towards the first, and it also flexes the metacarpal phalangeal joint. And we'll have Mickey demonstrate. So bringing there, perfect. Yeah. So that is adduction of the thumb. So it is the adductor pollicis. The next muscle we'll discuss is the flexor pollicis brevis, and this consists of two layers. A deep layer which arises from the trapezoid and capitate, and a superficial layer which arises from the trapezoid and flexor retinaculum. Now, the two layers merge into one tendon which inserts on the lateral base of the proximal phalanx of the thumb and the lateral sesamoid bone located at the metacarpal phalangeal joint. The actions of this muscle is that it moves the metacarpals anteromedially and in medial rotation, as well as flexing the proximal phalanx of the thumb. And we'll just have Mickey demonstrate that motion. Great. The next muscle we'll discuss is the opponens pollicis. This muscle arises from the crest of the trapezium and the flexor retinaculum on the anterior medial surface of the first metacarpal. It inserts on the lateral shaft of the first metacarpal. The actions of this muscle are it creates anteromedial movement of the first metacarpal by causing a strong medial rotation. Now, this is important in grasping movements. The next muscle is the abductor pollicis brevis. This muscle arises from the flexor retinaculum and scaphoid, as well as the trapezium, and inserts on the lateral base of the proximal phalanx of the thumb, next to the flexor pollicis brevis. The actions of this muscle are that it pulls the metacarpal anteriorly and flexes the metacarpal phalangeal joint.